You are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Okwan. Yes, we are still in the era of anatomy of clinical importance. And my friends, this is today's case study. A 30-year-old man whose hemoglobin genotype is SC presents to the emergency department with a 4-hour history of prolonged painful erection after consuming or taking an overdose of sildenafil for an enhanced sexual performance with a lady who failed to turn up. So my friends, this is the summary of the patient's presentation. And so the first question is that what is the most likely diagnosis of this patient's condition? Yes, my friends, your answer is Priapism. Okay, Priapism. Then the next thing is that what is the basis for this Priapism? My friends, whenever we talk about this Priapism, then of course we are talking about persistence of this kind of painful, erection. Yes, 4 hours and then even beyond. And often will be due to an imbalance between, of course, the vasodilatory and vasoconstrictive mechanisms that regulate blood flow to the penis. And that is why largely the structures that will be involved as far as this Priapism is concerned will be, first of all, something we call the cavernous bodies. And cavernous bodies, mainly we are talking about corpora cavernosa. Yes, we also have the corpus spongiosum. But one thing that you need to understand is that in the case of corpus spongiosum, the one where is just around what we call the urethra, okay, at the ventral aspect of the penis, that one usually, when the penis gets engorged with blood, okay, when there's erection, what happens is that that place is relatively, tender, it's soft, compared to what we call the corpus cavernosum, and then the plural, there are two of them, corpora cavernosa. Okay, at the dorsal aspect of the penis, we can feel that yes, that place becomes extremely hard on erection. And so the cavernous bodies, mainly, I'm talking about the corpora cavernosa, will be one of the structures that will be involved, because these spaces, okay, will get filled with blood whenever, of course, there's erection. And then, of course, the artery that is supposed to give blood, or the artery that are supposed to give blood to the penis or to fill these cavernous spaces, my friends, we are talking about, of course, the penile arteries, and we're talking about penile arteries. Then we are talking about the cavernosal arteries. And so these cavernosal arteries, or the deep penile artery or the central penile artery, is also very important as far as giving blood to the penis is concerned. Yes, not only that, even of course the dorsal penile artery is also very important. Yes, both of them are branches actually of the internal pudendal artery. Yes, not only that, even we see what we call the bulbourethral artery. Yes, we see what we call the circumflex artery. All these arteries, yeah, that kind of anastomotic connection, giving rich blood supply to, of course, the penis to ensure that there's erection, and that there is no ischemia, yes, as far as this penis is concerned. And then one thing is that we also have what we call the venous drainage, yes, to the, of course, to the penis. So after giving the blood, yes, if no erection, yes, after ejaculation or whatever, if it subsides, then what will happen is that there should be venous drainage. The blood that went in there after the cells have made use of it, the oxygen poor blood that we have now, the deoxygenated blood we have now, will have to be taken, back for eventually to the heart. And so what we are talking about is that, yes, we talk about, the deep dorsal, vein is important. Yes, we talk about, what we call the cavedorsal veins. Okay, they are also relevant over there. And of course, we talk about the para-arterial veins. Yes, as the arteries go, they go parallel to these veins. They are all important. And my friends, all these veins will drain eventually into what we call the internal pudendal vein, or into something we call the prostatic plexus of veins. So that is how it's going to be. And so what we are trying to say is that there should be a mechanism to regulate the flow of blood, okay, into the penis, and of course drainage of blood out of the penis. So now, based on this, then what are the two main kinds of Priapism, or this condition we are talking about? So it could be an ischemic Priapism, which is of course a very common, most common one. And so what we're talking about is that in the case of ischemic, Priapism, then the venous drainage is poor. Okay, such that what we see is that yes, I mean because of that there will be blood, okay, in the area of the penis with high, carbon dioxide level or low oxygen concentration in there. Okay, yes, that's what we're talking about, the ischemia in this case. And then it will be accompanied by acidosis. Because there's high carbon dioxide in there, then acidosis will set in. Okay, that's one of the things. And then in the case of the non-ischemic type, where it's another category, that one, there's no problem with, of course, the oxygen level. There's adequate oxygen concentration or partial pressure of oxygen in there is okay. And then also, we also have no acidosis. However, then it tells us that, of course, the problem has to do with a lot of arterial blood flow to the penis. And that is what is going to result in that kind of Priapism. But as I've told you, the common one, okay, I mean, the more common one is actually what we call the ischemic, Priapism. Now, understand that this patient had a history of, sickle cell disease. Is an SC patient. Now, if you talk about sickle cell disease, S beta thalassemia, SS, and what have you, but in this patient case, he has SC. And so you having SC is also one of the things, even after abusing the sildenafil or abusing anything which will enhance the sexual performance, ensure that there's prolonged, erection. Okay, one of the things that may predispose you to experiencing this Priapism is, of course, the fact that you have SC or any of the sickle cell diseases. And so what is going to happen is that the main reason is the sludging of the sickled red blood cells, okay, especially, and of course, the corpora cavernosa. And when this happens, it will lead to, of course, this kind of ischemic, Priapism. Because at the end of the day, as far as venous drainage is concerned, it will be very poor. Okay, so that's what is going to happen in this case of, this patient having, Priapism. And then also don't forget that this patient took an overdose of sildenafil. Okay, so taking an overdose of something is going to ensure that there's prolonged, what do you call it, erection. Okay, it's one of the things which can lead to, of course, this Priapism. Okay, apart from, of course, we know that normally individuals with sickle cell disease may experience it at some point in time. But one thing is that once you have taken, and especially you have abused this kind of, sildenafil or this kind of or anything which is going to enhance the sexual performance by prolonging your erection, then it's likely that it will lead to this, Priapism, especially when, of course, the lady you are going to do the thing with could not show up. Okay, could not, come. That is why you are going to have these kind of, problems. And so one thing that I need you to understand is that whenever you have such a thing, okay, yes, it's an emergency. Because at the end of the day, if you don't take care, then what happens is that the penis, okay, may lose its functional role. Because at the end of the day, if you have a lot of carbon dioxide, rich blood in there all the time, then there's going to be an issue. And remember that it's extremely painful. A lot of blood, maybe a lot of blood going in there, then it's going to have a lot of, serious, complications. And that is why you will send it to the emergency department for a timeous intervention. And so one of the things will be aspiration and of course irrigation. Yes, it could be done. And then of course you can give some medications like alpha adrenergic agonists can be given. Okay, and then also, sometimes if it's so extreme, then of course there will be the need for a surgical intervention. Okay, to try and of course resolve this once and for all. So whenever you are going to abuse some of these things, you need to be very careful and of course know everything about it before you do that. My friends, I believe you find this meeting helpful. I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.